Hello, welcome to chapter 23. We're going to be talking about the musculoskeletal system disorders. Our learning objectives are describing causes and symptoms of joint and muscle pain, discussing therapy for osteoporosis, explaining classes of medication used to treat the musculoskeletal conditions, describing how muscle relaxants affect the body, and appropriate patient education needed for patient safety, identifying the medication used for arthritis, providing patient education for compliance with medications used to treat diseases and conditions of the musculoskeletal system. Let's look at some musculoskeletal disorders, common symptoms. So the common symptoms can be joint stiffness, pain, inflammation. We also see weight loss, bone mass loss, deformation of bones, fatigue, malaise, weakness, fever, tenderness and swelling of joints and bones, and loss of motion and immobility. Some common side effects of the medication used for the musculoskeletal disorders are nausea and vomiting, pain in the abdomen, drowsiness, dizziness, headache, constipation, diarrhea, and sometimes we see visual changes. So the musculoskeletal system consists of two different systems that actually work together. What is accomplished through the collective functioning of the muscular system and the skeletal system? The body can be held erect and be mobile at the same time. They also give the human height and form of your body. Osteoporosis medications for treatment. Some common medications for osteoporosis. So calcium must be accomplished by vitamin D for effectiveness. Calcitonin, SAMin inhibitor, bone reabsorption and mimics body chemicals. It's used for treatment of osteoporosis, and it's not used as a prophylactic agent here. Let's see. We see in osteoporosis reduced bone mass, porous bone formation. Fractures are very common. The primary cause is disuse and lack of dietary factors. Again, we just talked about treatment using calcium because they have a lack of calcium. This is more common after the age of 50 in men and women, and accelerated by menopause. So osteoarthritis there's an inflammation of the joints, and it's accompanied by pain, swelling, and bony changes in the joints. And you can look at figure 23.3 in your book more closely. That's right here. So osteoarthritis, you can see here in the photograph. If you look closely, you can see here the swelling and the changing in the fingers. And again, this will also be found in your book. Joint diseases and their treatments, looking at rheumatoid arthritis. We treat rheumatoid arthritis conditions by reducing the body's autoimmune response to its own tissues. So rheumatoid arthritis is an autoimmune disease. And at what age do you think that rheumatoid arthritis generally peaks after you've read your chapter? It is between 20 years and 50 years of age. Medications. So what are the three goals of treatment for arthritis therapy? When we're doing treatment, we're thinking about we need to reduce pain, reduce inflammation and stiffness, prevent deformity. So we want to prevent the deformity. We want to maintain that joint function. The three drug classes are the NSAIDs, the DMARDs, and the glucocorticosteroids. Which of these three drug classes do you think help prevent the progression of the disease? That is correct, the DMARDs, the disease-modifying anti-rheumatic drugs. NSAIDs provide a rapid relief of symptoms but do not prevent the progression of the disease. They can be further divided into the salicylates like aspirin or the non-salicylates. They cause gastric irritation and bleeding. Aspirin is the least expensive treatment but is associated often with GI distress when taken over a prolonged period. It helps if they take the enteric-coated forms so that the aspirin actually can get into the digestive system before it is dissolved. In your book on table 23.2, we can see the common medications used for joint conditions, and at the top here you see the salicylates. It's also pronounced salicylates. As well as here looking at the non-salicylates. What would be the pros of using non-salicylates? So some patients who do not respond to the salicylates might respond to the non-salicylates. So this could cause less GI disturbances and the tinnitus. It's important to note that the FDA did put out an advisory in December of 2004, and to quote, it says, "The FDA is issuing a public health advisory concerning use of non-steroidal anti-inflammatory drug products, NSAIDs, including those known as the COX-2 selective agents. Recently released data from controlled clinical trials showing that the COX-2 selective agents," and they give examples like Vioxx and Celebrex, "may be associated with an increased risk of serious cardiovascular events." So heart attack and stroke were included, especially when they are used for long periods of time or in very high risk settings. So example, immediately after heart surgery. It's important to note this and understand that there are some severe side effects that can be related. So the COX-2 inhibitors do suppress inflammation. Again, an example is Celebrex, and it does appear in the generic form, and it's showed here, COX. Glucocorticosteroids. These reduce inflammation. They are available in oral medications and injections. They are short-term treatment, and it's indicated for patients who have not responded to other medications. Glucocorticosteroids do not halt the progression of the disease. They relieve symptoms of arthritis, but do not provide remission or halt the progression of the disease. So here we have those classes looking at DMARDs and then gold salts and miscellaneous drugs that are used. And this is where you can take some information this week in your online portion and make a little study for your top 5. What are some risk factors for gout? So looking at gout, obesity, alcohol use, hypertension, and exposure to lead are risk factors. Gout is associated with hyperuricemia, a high level of uric acid. The uric acid crystals deposit in connective tissue and joints. The onset usually occurs in middle age, most often affects the big toe, ankle, instep, knee, and elbow. And in treatment goals, they are trying to end the attack, prevent reoccurrence, and decrease complications. So oatmeal, red meat, tomatoes, alcohol, shellfish, cheese, and fatty foods should be avoided by patients with gout. Some indications of gout are acute pain, swelling, redness, warmth, and tenderness in joints. So looking at the muscles, we have spasms and spasticity. So the spasms result from involuntary contractions and must be treated according to cause. And spasticity is the hypertonicity of muscles resulting from neurological disorders or trauma. Skeletal muscle injuries are self-limiting. Some common causes of muscle spasms could be local injury, mineral deficiencies, or diseases that cause seizures. And common treatments for skeletal muscle injuries, they're most commonly treated with rest, physical therapy, anti-inflammatories, or muscle relaxant therapy. So skeletal muscle relaxants. They relieve muscle injuries and spasms. They depress central nervous system, can cause physical dependency when taken for a prolonged amount of times. This is very important to have that monitored, because when we are into a physical dependency, if we are continuing to give the drug without doing any kind of intervention, it can cause long-term dependency problems in multiple areas. So when you are educating patient regarding the skeletal muscle relaxants, you want to let them know that it can cause the central nervous system depression, so avoid driving and other hazardous activities. It does intensify the effects of analgesics, and they need to avoid alcohol. Here we have table 23.4, medications used to treat the muscle disorders and miscellaneous disorders. So I want you to take a closer look in your book. You can see that better there. All skeletal muscle relaxants have some effectiveness. So I'm going to ask you, what types of medications are used to treat local muscle spasms? And the correct answer is centrally acting muscle relaxants, or NSAIDs. So diseases with the muscle spasticity caused by muscle stimulation from spinal cord or brain, and they're seen in patients with spinal cord injury, stroke, MS, or cerebral palsy. Some common treatments for the spasticity is the treatments include centrally acting and direct acting muscle relaxants with physical therapy combined. Myasthenia gravis is a progressive and incurable autoimmune disorder. It's characterized by skeletal muscle weakness and fatigue. It's caused by loss of acetylcholine receptors. It requires lifelong treatment, and a common medication might be Middlase. They also have others listed here. My aunt has myasthenia gravis, and it is a lifelong challenge, and you can go in and out of that remission stage. Here you see the eye drooping. Do you notice that? So with myasthenia gravis, it affects involuntary muscles. So things like opening up your eyes, you're not able to send that response to the brain, or the brain isn't able to do that involuntary to the eye, actually. And so you'll see things like that. It also can be difficult to breathe because the diaphragm can be affected. So multiple different issues with the involuntary muscles. Myasthenia gravis is treated with the cholinesterase inhibiting agents that block the cholinesterase and allow the acetylcholine to accumulate. When we're educating the patient, we want to make sure that they understand how to evaluate the effectiveness of medication. And they do this by recording the time that the medication was taken, and then when the signs and symptoms reoccur. We sometimes give them a little journal to take home, but we definitely give them the information on how to continually take in and record this so that they can adjust, because patients that are taking the cholinesterase inhibitors must adjust their dosage as needed. There is no cure for myasthenia gravis. Fibromyalgia is a painful symptom